And it's time now to look at people getting vaccinated in South Africa, in Johannesburg in particular. And we're talking about people who don't have documents, undocumented people without any papers. And we joined on the line this morning by head of the Health Rights Program at Section 27, Sasha Stevenson. Sasha, good morning to you. Welcome, and we do appreciate you taking time out talking to us this morning.
Thank you. Good morning.
Yes, with the vaccination drive, the question of undocumented people has arisen. And just to understand what is the situation, what is the position as far as undocumented people are concerned?
Well, so far, up until now, it's been very difficult for undocumented people to get vaccinated because, of course, in order to be vaccinated, we all need to be registered on the EVDS system, and that requires an ID number. And so for a lot of undocumented people, they've been struggling to get vaccinated. Fortunately, a number of programs have started up very recently in the city of Johannesburg at the Hillbrow CHC, the Community Health Center, that allows for the documentation of undocumented people, for the vaccination of undocumented people. And they do so through creating basically a health file that allows them to register people on the EVDS system. So that's really good news because, of course, there are a number of undocumented people in the city. There's a need to get as many people vaccinated as possible, and this is a way of ensuring that everyone who wants to can, in fact, be vaccinated.
Sasha, I've noticed this is in the Johannesburg area. At this point in time, do we know that this is only taking place in Johannesburg?
No, it's most recently opened in Johannesburg, but there are also sites in Tshwane, in Durban, and in Cape Town, as I understand it. The details will be on the Section 27 website, so if people want to go and get all of the details of where you can be vaccinated in those different places, it's available there. But the program in Hillbrow just started up this week, and I understand it's going well.
Yes. Now, we know that there are many undocumented people right across the entire country. And, with the vaccination drive at this point in time gaining momentum, I'm sure that, it's going to be a huge task, firstly, because, it's moving away from the systems that have already been set up. Like you mentioned, the system that links you with the ID number. But with people that are undocumented, building on a system, but also at the same time maintaining a database. Now, I'm sure that has been pretty challenging as well, Sasha.
Yes, well, I understand the way that it's worked is that a kind of parallel system has been developed that gives people a number, essentially, that can then be plugged into the EVDS. So it's not creating a whole new system, but it's allowing people to get a number that they can use for health service. Which is a really clever and innovative way around the problem, because you're right. It's important that we maintain a database of who's getting vaccinated, so that we know our overall numbers and we know that how well we're doing. But this is a program that's been developed in collaboration with universities and the department, and seems to be going really well. So we can only just recommend and encourage everybody to get vaccinated as soon as they can as we hit the fourth wave.
Yes, and just looking at, Section 27, your role, your involvement in facilitating this process?
We're just encouraging people. So we work with a lot of people who try and access health services generally, including undocumented migrants, and we've been trying to assist undocumented people and other people from outside of South Africa who need healthcare services to access those services, as is their right. So we do that in general. But we're not the people doing the vaccination, obviously. We're just encouraging people and trying to mobilize as many people as we can to go and get vaccinated. It's open, it's free, it's available to everyone.
Yes, and this is part of your vaccine literacy program as well, because I know there's been a lot of advocacy, there's been a lot of information that Section 27 has been doing in terms of providing things like training materials and also information and misinformation about vaccinations. That's
right. We're hoping that we are busting some of the myths about about vaccinations, and also just letting people know what the situation is, what happens when you get COVID, what happens when you get vaccinated, trying to assuage some of the fears that people have, because what we know is that really the risk comes from COVID, not from the vaccinations. The balance of risk is so clearly in favor of getting vaccinated. And so we've been trying to speak to as many people as we can. We've got really user-friendly materials, infographics, as well as kind of written materials that are available on our website for everyone to go and see. And we're also available to answer any questions. It's very clear that the best thing we can do for our own health, for the health of our economy and our nation, is for everybody to get vaccinated. There's very few risks and a lot of benefits. And so it's important that everyone gets out there as soon as they can.
Yes. Now, just coming back to these undocumented people, how have they embraced this initiative?
There have been people coming into our offices for a long time asking what the program is and when they can get vaccinated. And so there's really a lot of eagerness amongst everybody to get vaccinated. And as I say, the program in Johannesburg has only started up recently, but it's going to be ramping up. There's a lot of interest amongst this population, and we can only encourage undocumented people and really everyone across the country to go out and get vaccinated.
Yes, and just finally, looking at the numbers and in terms of accommodating the numbers, are logistics in place? Do we have the infrastructure to cope with the large numbers of undocumented people in the country?
Yes, it seems to have been going well. There are a number of organizations that are collaborating in this effort together with the Department of Health, groups like MSF, Right to Care, and others. So really the infrastructure is set up. As I say, it started at Hillbrow, at the Community Health Center there. There's going to be mobile sites, as I understand it, around Uber Park and other places within inner city Johannesburg. So the infrastructure has been set up. There are vaccinators ready to go and certainly prepared to assist as many people as possible who come forward for vaccination.
Well, Sasha, thank you very much for that. And we do appreciate you taking time out to talk to us this morning, providing us with the information and also the update. And we wish you all the best. We wish you safety. We wish you good health and all the best in all your initiatives for you and Section 27.
Thank you so much.
Sasha Stevenson joining us this morning, and Section 27 is a public interest law center that seeks to achieve equality, social justice in South Africa, and they are guided by the principles of the Constitution. And when we're talking about vaccinations, we're talking about not only local in terms of their right to have to be vaccinated, but also taking into account the millions of people that, and we know about it, we are aware of it, that there are millions, there are lots of people in South Africa that are basically undocumented. These are people that have come into the country for various reasons, looking at opportunities, and also many that seek asylum that come through from all corners around the world. And we know that some of them are obviously illegal in the country, but at the end of the day, with the pandemic doing what it is, with the government encouraging people to get vaccinated, these people also would want to be vaccinated. So there we have a mechanism whereby undocumented people can get vaccinated in the country. And with that, the time is just headed for 9:29 a.m. And we've got quite an interesting discussion coming up next. And we're talking about the heritage status of keramids or mazars that we know in Cape Town. And they were, in fact, a few of the keramids and mazars in Cape Town will be getting heritage status today. We'll be talking by attorney Yusuf Khan Talwai, who is the PRO of the Cape Mazar Society.
These days, I'm more health conscious.